It's a day out of the clinic and on the road making house calls for Dr. Nina Malik, a Long Island veterinarian who practices integrative medicine for animals, a practice that combines Eastern and Western philosophies to help her patients with whatever problems they may have. Today, she's headed to Patchogue to visit a boxer named Samantha.
Sam is a 5-year-old boxer, and she just gets very, very nervous going to the clinic. She shakes and she doesn't travel well, so that is why I come to the house to treat her. And she tore one of her knee ligaments a while back, her right side, and we rehabilitated her. And a couple months after, she tore the left side, the opposite side. So now that's what we're focusing on. And she was very, very lame, but she's doing much better now.
Dr. Malik soon learns from today's house call that she's in for a bit of a surprise.
Hi! Hi! Who's that? Somebody new? What are you doing? Who's a good girl? Who's a good girl? Come here.
All right, it's okay. Her right leg is bothering her.
Come
here, pup.
No.
After a few months of positive progress, Sam seems to have re-injured her right knee, while her owner Janet Kelsky was away on vacation.
Come on. Come on, walk for me.
Once in the house, Dr. Malik takes a quick look to evaluate Sam's walking ability and concludes that her condition has indeed gotten worse.
Yeah, so she's definitely shifting weight off of that right hind today.
But soon it was down to their usual spot in the basement to treat the problem.
You gonna be a good girl today?
And getting this much-needed treatment, especially at home, has been a big help for Sam's health.
I chose to do house calls because Dr. Malik had offered me the opportunity to be treated in my own home. Samantha, is a little skittish. Like she said, she has a fire personality, and she gets a little distracted, and we felt that she would do better at home. Availability occurred, and she had said I'd be willing to do a home call and see how she does on that. And when we did the house call, it was just amazing how well she did and how more comfortable she was in her own environment.
Okay, let me just see this knee that's been bothering her.
And after a more in-depth evaluation of the injury, Dr. Malik begins an acupuncture treatment for Sam that will help relax her, increase blood flow to the injured area, and ultimately allow her to regain her strength.
Her leg, within probably six weeks, I saw a big change in her. Only problem was that we had all this snow this past winter, and it was very difficult for her to go up and down my deck, and she wound up injuring her other knee because she compensated. So we've been treating both knees.
In addition to helping patients like Sam feel more comfortable, house calls like these also help Dr. Malik gain a more in-depth view of what might be contributing to a patient's problems.
What's very interesting for me as a veterinarian is animals act completely different at home than they do in the clinic. And you don't really appreciate that when you're seeing all of your patients in the clinic. And now that I've seen patients that have been in the clinic and also then at home, I see how different they behave, and it really helps me understand how to treat them better. Often I find that when owners go away, that's when these guys get injured or re-injure.
After drawing her conclusions from the house visit, Dr. Malik offers some thoughts on what might have contributed to Sam's relapse, while Sam soaks up the benefits of the treatment, something she occasionally has difficulty receiving because of her excitable personality, but a process her owner says she ultimately enjoys.
She actually, as you can see, she falls asleep usually, and she just sometimes will just lift her head up to see if one hurts, but she's never ever tried to completely get up and try to pull him out at all. So that's proof in the pudding that it works, because it just, look at how relaxed this dog is.
Check when she gets up.
Okay.
See me get up.
There you go.
Yeah, she's definitely going to be sore.
Yep.
Because they did.
Soon the treatment is done, and it's time for Sam to gently begin walking on her injured knee. And by the looks of things, it's feeling a little better.
You silly puppy. What are you doing, huh? What a good girl.
The only trick now is that it stays that way until Dr. Malik's next visit.
Good girl. That's right.
Good girl.
Okay. See you next time.
From Patchogue, this is Robert Libetti.